Watch how someone changes their clothes this week, because after 70, that one small habit can tell you more than a checkup sometimes does. There are certain hygiene habits that look completely harmless on the surface, yet they worry a geriatric specialist more than plenty of things that send people straight to the emergency room. Someone in this field for more than 2 decades can usually spot these within seconds of walking into a room, while the family, standing right there, rarely notices a thing. When people hear the phrase hygiene mistakes in older adults, they usually picture someone unkempt or a little unwashed, but that's not really what this is about. What years of clinical experience actually reveal is that these small, overlooked habits are often the earliest warning sign that something deeper is shifting, sometimes months before any blood test or scan would ever catch it. So today, we're breaking down 6 of these warning signs, why each one carries more weight than you'd expect, and what you can actually do about each one starting today, and honestly, the one at number 3 might catch you off guard. If you find content like this useful, tap that like button. It's a small action, but it's genuinely how other families stumble onto information they didn't know they needed. Number 1, wearing the same clothes or pajamas for several days in a row without changing them. It's easy to wave this off. Plenty of people lounge around in the same comfortable outfit, and at a younger age, that's rarely a problem. But after 70, skin doesn't bounce back the way it once did. The natural bacterial balance on its surface shifts, and when fabric sits against the same spots day after day, especially in warm folds like the underarms, groin, or beneath the chest, you're basically running a small incubator. Think of it like a damp towel left balled up in a gym bag. The longer it stays there, the faster things grow. Skin infections have shown up in patients where the cause wasn't a weakened immune system or a chronic illness at all. It was simply the same nightgown, worn for 9 straight days, because getting dressed felt like too much to manage. That detail, the getting dressed part, is actually the one clinicians pay closest attention to, because when someone stops caring about changing clothes, it can be one of the very first behavioral signs of depression or a cognitive shift. It isn't laziness, it's a signal worth paying attention to. The fix isn't complicated. Build a simple rotation, 2 or 3 comfortable outfits swapped every day or 2, even on days when nobody's stopping by. But the next habit on this list catches families even more off guard. Number 2, letting regular hand washing slide throughout the day. Nobody thinks twice about hand washing until flu season hits the news, and then it's forgotten again by March. But for someone over 70, the immune system has already lost a meaningful chunk of its quick responsibility. The medical term for this is immunosenescence, and in plain English, it just means the body is slower to notice and fight off new threats, like a smoke detector with a weaker battery. So when an older adult touches a doorknob, handles raw food, or uses the bathroom and skips a thorough wash afterward, the window between exposure and actual infection is meaningfully shorter than it would be for someone in their 40s doing the exact same thing. Urinary tract infections, stomach illnesses, and respiratory infections have all been traced back to nothing more dramatic than inconsistent hand hygiene at home. And here's the tricky part. These infections often hit harder in older adults than they would in someone younger. A stomach bug that puts a 35-year-old on the couch for a day can put a 78-year-old in the hospital with dehydration. The margin for error simply gets thinner with age. The fix is straightforward. Soap and water for at least 20 seconds, especially before eating and after using the restroom. Hand sanitizer works in a pinch, but it doesn't fully replace washing, because it can't eliminate certain bacteria the way friction and running water do. Now, number 3 could honestly fill an entire episode on its own, because it may be the most overlooked hygiene area in aging adults, neglecting ear hygiene and hearing aid maintenance. Families have walked in convinced a parent's memory is slipping, that conversations are getting lost, that something neurological is happening, when the real culprit was compacted earwax the whole time. That's not an exaggeration. Earwax impaction in older adults can genuinely mimic the early signs of cognitive decline. It muffles sound, breeds confusion in group settings, and gradually isolates someone socially because they quietly stop engaging in conversations they can no longer follow. And if hearing aids are part of the picture, the problem compounds. A hearing aid that isn't cleaned daily turns into a warm, moist incubator sitting directly inside the ear canal. Chronic outer ear infections, some lingering for months, have been traced to hearing aids that were never properly wiped down or dried since leaving the box. Picture wearing the same damp socks every single day and wondering why your feet keep getting infected. It's the same principle, just a different body part. The fix takes about 2 minutes a day. Wipe hearing aids with a dry cloth and the small brush that comes with them, and for the ears themselves, a warm washcloth around the outer ear is usually plenty. If wax buildup becomes a real concern, a doctor can remove it safely. Cotton swabs pushed into the canal, just pack it in deeper and make things worse. If this is proving useful, whether for yourself or for a parent you're keeping an eye on, go ahead and subscribe. This kind of content comes out regularly, and it's built to help you catch these things early. Number 4, Not washing sheets, pillowcases, and towels often enough. This one flies under the radar because bedding tends to feel clean as long as it doesn't look or smell dirty. But past 70, skin sheds cells faster, produces different oils, and becomes more prone to irritation. A pillowcase left unchanged for 2 or 3 weeks is quietly carrying a heavy load of dead skin, dust mites, bacteria, and accumulated sweat. Worsening eczema flares, unexplained facial rashes, and even chronic sinus congestion have improved dramatically once bedding changes became more frequent. For someone with thinning skin, sleeping on that buildup night after night isn't neutral. It's a slow, ongoing strain on the skin barrier that adds up over time. The clinical guidance is simple. Wash sheets and pillowcases weekly in hot water and towels every 3 to 4 uses. It sounds basic because it is, yet the number of households where an older adult's bedding goes 3 or 4 weeks untouched is far higher than most people would guess. Number 5, and this one doesn't get talked about nearly enough, using personal care products that have expired or become contaminated. Open almost any medicine cabinet in a home lived in for decades, and you'll find face creams years past their prime, half-used eye drops with crusty caps, and lotions separated into layers that were never supposed to exist. This isn't a character flaw. People buy products, use them for a while, push them to the back of a shelf, and simply forget. But once a product is opened, bacteria start colonizing it almost immediately. The preservatives in most creams and drops are built to hold contamination off for a specific window, usually 6 to 12 months. Past that point, you're essentially applying bacteria directly onto skin or eyes that are already more vulnerable than they were at 50. A stubborn case of conjunctivitis in an older patient that wouldn't respond to antibiotic drops, resurfacing every few weeks, turned out to be self-reinfection from contaminated eye drops used every single morning. Once the bottle was replaced, the infection cleared within days and never returned. Go through this medicine cabinet every 6 months. Anything without a readable expiration date or anything open longer than a year should go, and a pharmacist can help sort out what's still safe if there's any doubt. And finally, number 6, skipping regular nail trimming and basic hand care. Nobody's excited to deal with toenails, especially once they've thickened to the point where a standard clipper barely makes a dent. But thickened, neglected nails aren't just a cosmetic issue. They can harbor fungal infections that, in an immune-compromised older adult, can spread beyond the nail bed into surrounding tissue. On the hands, rough cuticles, small hangnails, and cracked skin around the nail fold create easy entry points for bacteria. Cellulitis, a fast-spreading skin infection that can land someone in the hospital, frequently starts at exactly these small, ignored openings. A swollen red finger that progressed to the point of needing IV antibiotics traced back to nothing more than a tiny hangnail that had been picked at for about a week. At 40, the immune system likely handles that without issue. At 76, it can escalate fast. The fix doesn't need to be complicated. A simple trim every 2 to 3 weeks, a bit of moisturizer on the cuticles, and if the nails have become too thick to manage safely at home, a podiatrist can take care of it in about 15 minutes. No shame in getting help with something that's genuinely become hard to do alone. So those are 6 hygiene habits worth watching for, and none of them require a medical degree or a complete lifestyle overhaul to address, just a little more attention than most of us usually bring to the small, everyday things. If any of these sound familiar in a parent, a spouse, or even in yourself, drop a comment and share which one caught you off guard. That kind of comment is often exactly what helps another viewer notice something they'd been walking right past. And as always, talk to your own doctor. Before changing anything about your routine, medications, or supplements, this is general awareness, not a substitute for personalized medical advice. See you in the next one.